This video will cover Polycythemia vera, a myeloproliferative neoplasm. The anchor for this video will be this political science class, because political science is often referred to as poli-sci, which sounds similar to polycythemia. To remember that this is a myeloproliferative neoplasm, all we have to do is notice what university this class is taking place in. Once again, it's this metropolitan company. They seem to be taking over. For us, if you shorten metropolitan, you can spell it like MPN, just like myeloproliferative neoplasm. Let's talk about how these patients tend to present. Hypertension, thrombosis, pruritus, plethora, erythromelalgia, and headache are all common presentations. I'm only going to create a prompt for some of these since I think the others are pretty straightforward to remember. To help us remember plethora, pruritus, and erythromelalgia, well, just look at the professor here. Poor guy, he's really in distress and nobody really seems to care. One of the associated symptoms with polycythemia vera is Budd-Chiari syndrome. You guys remember that famous baker that had a TV show and even had a bunch of vending machines that sell his cake? I've never tried his baked goods, but I hear they're overrated. Let me know if it's worth it. But for us, since the baker's name is Buddy, that will help us remember Budd-Chiari syndrome. Alright, I know you recognize this character. And you're right, this is the famous Jack Sparrow. This will be a really easy way for us to remember JAK2 mutations, which are the most common mutations in these patients. With all the political turmoil going on nowadays, it doesn't surprise me that there's an agent down here. This is an EPA agent, which for us represents erythropoietin, which is often shortened to EPO. The fact that he's down is going to help us remember that EPO in these patients is expected to be low. I guess the gym bros can never really put their weights away. They even had to put up a sign here to tell students to stop bringing their iron dumbbells. This sign will help us remember that iron in the marrow is expected to be decreased or absent. An important caveat is that this is a pattern expected in the proliferative phase of polycythemia vera, which comes before the spent phase of polycythemia vera. We'll talk more about the spent phase soon. Speaking of marrow, the bone marrow is expected to be hypercellular in the proliferative phase. This is, as usual, represented by this person here with a bone broth drink that is overflowing. Alright, the last thing to remember is that in the spent phase of PV, we see marrow fibrosis, which is usually stained with a reticulin stain for better visualization. If you notice this one student here, she's about ready to open her snack, which is a Fiber 1 granola bar. The Fiber 1 granola bar represents fibrosis for us.